Start.
So, Milind, we met this time last year and we discussed your plans for this institute. So, what sort of progress have you made, or what challenges have you faced?
I think we had like double pronged thing. So we wanted to do research as well as provide clinical care. And I think clinical care is doing very well. Now we have this 60-bedded hospital with about 10-bedded emergency care unit, which is running almost 80% occupancy. And we're treating all sorts of neurological patients, acute care, trauma, stroke, spinal cord injury with very good results. We have now ventilators and we have a fairly well equipped OT, OR. Our rehab setup has expanded. So we're working on complex gait and balance therapies, and we're also getting a gait lab, which is probably there are only 4 or 5 gait labs in India. So that will do 3-dimensional gait analysis in neurodegenerative diseases. So that should be here within next week. We have 2 ambulances and we have a BCOPD. As far as the research part is concerned, we have ethical committee and we have put 2 proposals through ethical committee. But we're still kind of trying to set up the research protocols. So it's kind of time consuming to get the right people and to get things done in a specific way. We have 2 publications in last year coming from Arogyadham. So, but we are progressing.
So, have you managed to get a full complement of staff? The staff recruitment is a problem in this part of the world.
It's hard. This being a fairly specialized neurological setup, any staff I get, I will have to train them or retrain them. And we're working on it. So as far as nursing staff is concerned, I think we have fairly good nursing staff. The supporting paramedical workers, we have recruited them also. Doctors is an issue. We haven't got any specialized doctors, no specialists. No one wants to come here. We have MBBS, 2 MBBS doctors who are again new to the neurological setup, but they are learning. And the best thing is our rehab is expanding. We have one of our neuro rehab directors has done her master's in balance and gait, and she specializes in advanced postural adjustment trainings, APA, anticipated postural adjustment. So she's setting up the gait and posture rehab. And then we have another physiotherapist who is very good at what he does. We have 2 physiotherapy assistants. We have a speech therapist. We have a yoga and meditation person. We also are getting an acupuncture person. Will be joining next month. We have a rehab psychologist. So she does the psych rehab. So rehab setup is expanding the way we want. Our clinical setup is slowly expanding. Staffing is an issue. Getting right people is an issue. Research, we're just starting. So.
The last time we discussed about research integrated with Ayurveda. So any progress on that, since this is an Ayurvedic institute?
The first trial, that McCuna trial, the trial about naturally occurring levodopa drug, which is mentioned in Vriksha Ayurveda, it's called Kavach Beej. The botanical name is McCuna puriens. That trial is approved by ethical committee. We have 150 patients ready to enroll. We have consent forms, CRF. We're just waiting for a person to be hired who can do the UPDRS testing on all these patients at a regular interval. UPDRS motor UPDRS is a Unified Parkinson's Disease Rating Scale.
Yes.
And motor UPDRS is the part 3 of UPDRS, and that takes about 2 hours on every patient. So we need a full-time person who to train to do the testing and make sure that there is no inter-rater variability, and then we'll start this. So, but we have patients for that, we have the drug, and we have protocols ready. We just need to start it. I hope this will start before summer.
So will it be a double-blind trial? Or?
No, it will be open label, prospective, safety and efficacy trial. It will be single blind. The rater will be blinded, but the patient will not be. So it will be a crossover study. So 3 months on this and 3 months on that, and then again 3 months back on the drug. So.
Okay, I can fully understand that you being a neuro specialist, this hospital is becoming a neuro specialist hospital. So how about other specialties? How can we?
I think I want them to come. I mean, more the merrier. We need a cardiologist, we need an endocrinologist. There is so much of diabetes in the region. It's completely untreated, neglected. People don't even care about diabetes. We have a lot of patients with heart disease. We need a good internist who can take care of that. There are a lot of patients with GI issues. It's a very, very common complaint, gastrointestinal issues. So, an internist who can handle this, or a GI specialist. We need an anesthesiologist, we need a general surgeon, we need an OBGYN specialist, pediatrician. So, I think if I had to make 4 people who will make this hospital kind of foolproof, then definitely internal medicine specialist, OBGYN specialist, anesthesiologist, and general surgeon.
But you need these people to come and spend a period of time here.
Extended period of time will be better, because this is a completely different culture to work in. So anyone who comes in has to settle in, get used to what we have and what the patients want. You have to work on your medical instincts rather than investigations. So you need a comfort zone to do that. It takes a while before you forego your thinking that, okay, this needs to be investigated, I need a proof before I treat. So here you treat and positive results is your proof, because they really cannot afford and there are no places where they can go for investigations. So that's a complete 180 degrees turnaround in the mentality that we have right now in modern medicine. So someone who can come for say 3 months or more than 3 months, that will help us quite a bit.
Just somebody coming for a week is not particularly useful.
I think week will be useful in the sense that he or she can help train people.
Yes.
He or she can do some specialized clinics or camps, so we can advertise in advance that we have a endocrinologist coming or a gastroenterologist coming, and then we can get all the patients in the region to do the camp. So that will help. But sustainable functioning of the hospital and sustainable growth of the hospital can be done by people who come for extended periods of time.
So how can Seva UK help any further with what we're trying to do?
I think as far as the financial support and infrastructure is concerned, I think we are managing it pretty well. We just need manpower, specialized manpower.
Yes.
So if Seva UK could provide us with specialized manpower, people coming from India or outside India who want to come for a short period of time or extended period of time, surgical disciplines, non-surgical disciplines, I think that will be the best help.
Thank you very much for your time, and we'll catch up again soon.
Also, if we can set up trainees rotating with us,
Trainees, okay.
that will help us a lot.
Okay.
That will help them a lot. This is a completely different world of medicine. So what they're trained in UK or US, here it's completely different. They get to see cases which they have never seen before. At the same time, we get people who will help us with our patients. So it will help them and it will help us. So a regular turnover or a regular MOU with teaching hospitals
Teaching
in
hospital in the UK,
US.
yes. Yeah.
And the internship like thing, like 3 months of externship or internship, what they call it. If they make this a center, optional center, that will help us.
Yeah, makes a lot of sense. I mean, in the UK, in 50 years practice there, I've seen 3 cases of oral cancer.
Right.
Here in Chitrakoot, in the last 2 weeks, I've seen about 7 cases of oral cancer. So you see pathology here, which you don't see anywhere else. You're quite right about that.
And that way our center gets on the international map, and we can collaborate with the teaching hospitals to set up practice protocols and things like that. So that will help us also to grow, and that will help the students coming also to grow in their clinical knowledge.
Excellent. Thank you.